Hello! In Module 1, we will get introduced to several important terms, like the personal health record, the electronic medical record, and the electronic health record. The electronic medical records are also known as EMRs. They offer a digital way to store information about medical care. They can be accessed by all members of the team, but only if they are members of the same hospital. Electronic health records, which is the second term that we are going to be introduced to today, are also known as EHRs. They show the total health of the patient. An EHR can be shared with other medical practices or hospitals. Personal health records contain electronic health records data and are accessed and managed by patients through a patient portal where patients can read their test results, they can enter data on their own, and they can download records. The personal health record is a tool through which individuals can manage and share their own health information held by medical institutions and self-generated health data. The patient portal is important in the personal health record. This is an information technology application that is used in the field of healthcare to strengthen communication between patients and healthcare workers and facilitate participation by patients. This personal information in the personal health records can include data such as the patient's medical history, applicable diagnosis, historical and ongoing medications, including over-the-counter medications and alternative treatments. Past medical and surgical interventions can also be part of the personal health records. Also, immunization data can be included, allergies and other relevant medical conditions that can impact the delivery of emergency care, such as type 1 diabetes and others, blood type, including whom to contact in the event of emergency. The personal health care data, health records, can include insurance information. They can also include contact information for the patient's regular health providers. Here we can see some countries that have their patients' portals, and if you look at this table, you will see that these countries have decided to include different special features. For example, in the United Kingdom, they have decided to include clinical trials and organ donor information, while in others we have different kinds of declarations. In Sweden and Finland we have community care notes, etc., etc. So in the different countries, different specific details can be included in the patient's portals. Electronic medical record. These records are digital versions of the paper charts of the clinician's office. The EMRs are used by healthcare practitioners to manage healthcare delivery. The environment is composed of clinical decision support, clinical document applications, and other entries. They allow access to tools that providers use to make the patient's decisions. The electronic medical records contain the medical and treatment history of the patients in the practice. So, the EMRs have advantages over paper records. Some of these advantages allow the clinicians to track data over time, for example. They can easily identify which patients are due to preventive screening measures or checkups. The clinicians can also check their patients, how their patients are doing on different parameters, such as the blood pressure readings, blood sugar levels, or vaccinations, so they can monitor and improve overall quality of care in the clinician's practice. What about the electronic health record? According to the International Organization for Standardization, the electronic health record means a repository of patient data in digital form, stored and exchanged securely, and accessible by multiple authorized users. This is very important, that multiple users can have access to the electronic health record. This record contains retrospective, concurrent, and prospective information, and its primary purpose is to support continuing efficient and quality integrated health. The electronic health records offer several features that are beneficial to the healthcare industry. Some of these common features are useful for everyone. For example, the electronic health record helps to manage order effectively. They support patients, they are efficient and secure. We can have reportings and notifications, and we can achieve a proper workflow management that is extremely important in the healthcare establishments, as well as we can have health records and data. In this slide, we can see the differences between the electronic health records and electronic medical records. For example, in the electronic health record, we see a digital record of patients' health information, while the electronic medical record is actually a digital version of a chart. The electronic health records are streamlined, sharing with other providers and labs, so we can achieve an updated real-time information. On the other hand, the electronic medical records are not designed to be shared outside the individual practice. So you see that in the electronic health record, we can have multiple users and multiple healthcare workers can have access to our electronic health record, while in the electronic medical record, only the healthcare workers at one establishment, one hospital, one clinical practice can have access. Other differences between the electronic health record and the electronic medical record is that the electronic health record allows the patient's medical information to move with them. So they can carry the information from one place to another, but the information is with the patient. While then the medical record, the electronic medical record, the patient record does not easily travel outside the practice or the hospital. In the electronic health records, we have access to tools that providers can use for decision making. But in the electronic medical record, we can use, the data can be used mainly by the providers for diagnosis and for treatment. That was all for the first module. Thank you very much for your attention.